everybody. Welcome to the Path to Becoming a Mom Fertility and Wellness Summit. My name is Wendy Oaksler. I'm from livingleela.com, and I have the great honor to be sitting with my very good friend and amazing colleague, Wendy Shubin. I am so excited about your talk today. She's talking about we are our own best therapist, an osteopathic approach to fertility. And one of the things that I find so intriguing about Wendy, other than she's an amazing human being, is her very unique perspective of fertility, because she has a background in both Eastern and Western medicine. So I'm sure she'll tell you more about that, but the kind of the short answer is that she's been a physician's assistant specializing in OBGYN and reproductive endocrinology since 2001.
2001, I know, long time.
Yeah, and probably a yoga teacher about that long too,
Yep.
right?
Yep.
And she, like myself, is also a certified yoga therapist. And so I'm really excited for you to jump into your talk. But before we do, I just want to let our listeners know that she is being extremely generous, and she's going to have a few different gifts for you guys at the end. So do stay tuned to listen in for that. A couple will be exercises and meditations, as well as a free consultation with Wendy. So without further ado, I would like for you to jump in.
Thank you for that beautiful introduction. My name is Wendy Shubin. I am a physician assistant in reproductive endocrinology since 2001, and a yoga teacher since then. About 5 or 6 years ago, I became a yoga therapist due to a traumatic neck injury that I had, and I started seeing an osteopath because allopathic Western medicine just kind of failed everything. And I was kind of deep in it. And it cured me. So I decided to dive deep into yoga therapy training with my teacher, Jasmine Lieb, and to start studying osteopathy, because I was just amazed that the human hands could actually heal, and that our bodies could actually heal ourselves without having to do surgery or take medication and having all those negative side effects. So one day I was teaching a yoga therapy class, and my colleague, Ben Hubers, came into my room, and he taught me Aldoa. And I thought, what is this stuff? This is like crazy. Like, we're flattening our lumbar spines and we're doing all that. Like, no, this is crazy. And he challenged me to take a course. And I took him up on his challenge, because I never not do that. And I met Dr. Guy Boyer and his osteopathic approach to the human body. And from that moment on, I dove into his program. So it's been about 2 years that I've been really engaged with his Aldoa program, his Soma training program, and the Soba therapy program to learn osteopathy. And I currently see patients and do manual therapy and prescribe programs for patients as well. So I'm going to talk to you about Dr. Guy Boyer's paradigm and how it relates to fertility and how we have the ability to heal ourselves.
Awesome. Are you ready to launch your presentation? So we'll just do a little bit of tech work here for a second.
Got it. So I want to define osteopathy, and this is going to be the distilled version of it. There's much more complicated ways to explain it. So osteopathy was invented by A.T. Stills. He was a physician and a surgeon back in the 1800s. He believed that the current medical practices during his time was causing more harm than good, because conventional medicine had failed to find the cause of diseases as well as effective treatments. So the main osteopathic principles have not changed since the 1800s at all. And the first one is that osteopathy is a preventative medicine. So let's just not get sick and we won't have any problems. Osteopathy also promotes in treating the disease rather than treating the symptoms. So let's find the root cause of our symptoms so that we can resolve them, or the root cause of the disease so we can heal our symptoms. And so often we take Tylenol for a headache, but why are we having a headache? At osteopathy, also believes that the body is capable of treating, excuse me, it believes it's capable of self-regulation, self-healing, and health maintenance, and that the body has the ability to actually heal itself. Now, part of that is that osteopathy believes that disease, physiologic function, and the musculoskeletal system are fundamentally connected. And that's through our fascial system, which we're going to talk a lot about today. And finally, osteopathy believes that by diagnosing and treating the musculoskeletal system, a variety of diseases can be treated without exposing the patient to the negative side effect of drugs. And I know we've all been exposed to negative side effects of medications, and we try not to take them as much as possible, but so often we want that quick fix instead of doing the work to actually heal the root cause. So this is not a new field of medicine, and it's definitely not a new concept, but it's a field of medicine that's been really slow to be adopted by allopathic medical providers, including myself when I first started practicing medicine. And this is for really good reason. So in medical school, we are taught to cut through the fascial layers to reveal our internal organs. And we're taught that each organ system works independently from each other. So we see a cardiologist for the heart, and we see a pulmonologist for the lungs, and we see a kidney doctor for the kidneys, and a gynecologist for our reproductive organs. But all of these organs intertwine and connect with each other. And we know this through the work of A.T. Stills, but we also know this through studying the fascial system, and we know that our physical structure dictates the function of our bodies. All right, so let's talk about our health and our fertility as it pertains to pregnancy, because if we really look at how we get pregnant, pregnancy is actually a complete miracle. There are so many physiological functions that need to happen in order for us to conceive. And if one little thing is off, then the whole system's down. So I usually like to explain it like a computer. So like if one wire is cut in our computer, our computers don't work at all, or they don't work well. So if we get the wire fixed, then we get the functioning of our computer to work. So if we can fix the reason why we're not getting pregnant, and it could be one little wire, then maybe we can conceive, and maybe we still need reproductive technologies, but that's the angle that we're going for today. So what can go wrong? Okay, so let's say the egg doesn't get picked up by the fallopian tubes. The egg is expelled into the peritoneal cavity. I mean, that's a huge cavity, and it somehow has to find its way to a fallopian tube. The little hair-like structures in the tube may not push the egg down the tube. Sometimes the sperm can't get through the cervix. Our cervical mucus can be a hostile environment for sperm, so in which case the sperm won't survive. And if the sperm does get through the cervical mucus, is it able to actually swim and get to the egg? If it does get to the egg, is the egg able to be penetrated? So is there a hard shell around the egg? Is the sperm strong enough to actually penetrate the egg? And then we have to look at the receptivity of the uterus. So is the endometrial lining where baby implants, is that receptive? And that can be due to like a lack of hormone support or a polyp or a fibroid. Sometimes we have a uterine anomaly where we can have what we call a didelphys uterus, so like two uteruses. Sometimes we can have bicornuate uterus or a septum. And these are just some things. These are not all of them. And then we have to look at, are we actually having a healthy sperm and a healthy egg? Are they chromosomally normal? And sometimes mom and dad have chromosomal problems where they can't actually create a normal, healthy embryo to even conceive and get pregnant. And then the other question is, does a mom have a blood clotting disorder? And that prevents implantation or may increase the risk of miscarriage. So, and again, these are just some of the moving parts. There are many more that I'm not discussing. But if we look at a pelvic ultrasound, and the reason I want to bring this up is because we all think that when we look at a uterus under the ultrasound or an ovary, we just see the uterus and we just see the ovary. But, and I'm pretty much an ultrasound tech at this point in my career. If we look at the uterine if we put a probe inside the vagina and we look at the uterus, we are seeing everything else that's in there. So we're seeing the gastrointestinal tract, we've got the large intestine, the small intestine, we've got the ovaries. We don't really see the tubes, but we also see a lot of blood vessels. So there are no free spaces between any of these systems. Everything's mushed together. So we have to find the structures that we're looking for. So I just want to propose a question, just food for thought, as I'm giving this presentation. Is it possible that if we have a structural dysfunction, that it will negatively affect the organs of reproduction and stop us from being able to function healthily or even get pregnant? And then is it possible that if we normalize this fascial system, these connections between all these organs, will it improve the function of our internal organs and allow us to get pregnant? And the whole idea, again, about osteopathy and Guy-Voyer's paradigm is that structure really dictates function. And I don't want you to misunderstand me. I practice reproductive endocrinology, and there is definitely a time and a place for allopathic medicine. Age is not going to be reversed by osteopathy. So, and sometimes time is not on our side. And that means IVF may be your best option to conceive quickly or to ensure that you're going to have a baby in the future. And in fact, I encourage all women in their 20s to freeze their eggs, because that's when you're going to have the best quality frozen. We need to have a lot of eggs in order to get pregnant. I think I read a statistic from START that in your, oh, this was interesting. If you are over 44, you need over 100 eggs to get, I believe, the chance of one being normal. That's a lot of eggs. That's ridiculous. So, and obviously the chance in our 30s goes down. I think it was 25 eggs if you are 35. Now, don't quote me on these numbers, but that's what I remember seeing. So using one cycle of an egg freeze in our 30s typically is not enough. We need to use multiple cycles. Okay, so with this being said, all the modalities that we're discussing, that I'm going to be discussing today, is not going to reverse the age of your ovaries. It's not going to unblock your tubes. It's not going to improve sperm count, at least in a timely manner. And if you have the time and the patience, this is something that you may want to consider just in daily life, because if we get every organ to function properly, we can actually be healthy, happy adults, as well as be able to conceive naturally. So I want to talk about fascia, and everything is about fascia. Fascia is like the new in word nowadays. And the easiest way to think about the fascial network is to envision that our bones are floating in a sea of connective tissue. So with that being said, what is fascia? So fascia is our connective tissue, it's our ligaments or tendons, it's our interstitium. It also interpenetrates and covers every cell, every muscle, every bone, every nerve, every artery, every vein, and every internal organ. It stores water. It's actually 60 to 75% water if we're really hydrated. It also carries voltage, so it acts like an electrical wiring system, and that's because our nervous system is embedded in our fascia. So fascia functions as one large organ, and there's no beginning and there's no end of it, so it's all completely connected. It kind of like is a circular motion of this tissue that just wraps and winds. It's also omnidirectional. So we have fascial layers that run in specific directions, but each of these layers are connected, thus making it omnidirectional. So, you know, the fascia that wraps around your thigh bone, there's a vertical one that goes in line with one of the muscles, and there's an oblique line, and then there's a horizontal line. And all these horizontal layers meet up together into our RT band. So we can't look at fascia as running in one direction. We have to look at it as running everywhere. Now, there's three components of fascia that you need to understand to understand why it's so important. And these are the cells, the fibers, and the matrix. So the cells that make up our fascia, the first one is a fibroblast, and that's just produces the structural framework for our fascia, and it plays a critical role in wound healing. Mastocytes are a type of red blood cells of connective tissue, and that plays an important role in wound healing, in the development of new blood vessels, immune tolerance. It defends against pathogens, and it helps to function with our blood-brain barrier. And then there's adipocytes, and everybody knows what adipocytes are. Those are fat cells. And we actually want fat cells. We don't want to get rid of all of them. They specialize in fat storage. But they also help to regulate the temperature of our internal organs. They act as shock absorbers, and they also store energy. Now, macrophages are large white blood cells that locate foreign bodies, and they eat them. This is a physiological function called phagocytosis. And then we have plasmacytes. And plasmacytes originate from our bone marrow, and they secrete large quantities of proteins called antibodies in response to an antigen. So like when you get tested for the chickenpox virus to see if you're immune to it, we'll check to see if you have antibodies. And if you have antibodies, that means you've been exposed to the antigen. And then we have leukocytes. And leukocytes are white blood cells involved in protecting the body against both infectious diseases and foreign invaders. Now the fibers. There are three things that make up our fibers, and that's collagen, reticulin, and elastin. Now, collagen manages the tension and pulls water into our cells. That's what allows our fascia to stay hydrated. Reticulin is a type 3 collagen, and it forms our scar tissue when we get injured. So if we get a cut, we get a scar, that scar is the reticulin. And then elastin is a protein that allows the tissues in our body to resume their shape after they've been stretched or they've been contracted. And then the matrix of the fascia is made up of glycoaminoglycans, and they support the maintenance of collagen and the elastin. So they're found in all of our connective tissue, in our extracellular matrix of the fascia, and then also on the surface of many cells. Okay. So fascia has responsibilities. But again, the easiest way to understand our fascia, and I'm going to say this multiple times probably, is to envision it as our organs are floating in a sea of connective tissue. So fascia and all of its components, they provide a link from bone to bone, from muscle to muscle, to our internal organs, and then back again to the supporting structures. So if you look at the pictures to the right, you can see that there's triangular shapes of our fascia, especially in the picture of the man in the fetal position. So the triangular shape sustains tension and integrity to keep the shape of our structure. And if part of the triangle gets damaged, it just makes a larger triangle so the integrity of the structure does not get compromised. So fascia's responsibility is, number one, to provide structure through the tensegrity model. And that's the basic structure, is this triangular shaped nonlinear model. It's kind of like a spider web, and you can see in that lower photo. Because the triangle is the strongest geometric shape, this is what the body uses for the tensegrity model. Now, fascia's job is also to circulate blood, and an interesting fact that blood is connective tissue. So since blood is a connective tissue, it is also part of our fascia. All right, fascia is also supposed to, or its responsibility is to regulate the structure and function of the nervous system. And again, fascia carries voltage. Its job is also to communicate. So again, the nervous system is embedded in our fascia, but there's also proprioceptors in all of our joints to let our body and our brain know where we are in space. And because it's in our joint spaces and we have ligaments in our joints, and ligaments are fascia, it allows us to communicate with our brain so we can move properly. And then it's also to provide energy. Again, those adipocyte cells are part of our fascia and they store energy. It also has a defense and protective responsibility. And that's if we go back to the cells that make up our fascia, there are some for defending against attack, and there's also ones for healing. And then again, that scarring effect. And the scarring effect creates a stronger structure after we've been traumatized or we've had an injury. So the tensegrity model, okay. And this is, I think we got the tensegrity model from like the Golden Gate Bridge. We realized that a structure can sustain itself if we make these triangular shapes. So fascia's function ultimately is to normalize the tension of the whole body. And one of the primary ways, and that's one of the primary ways that the fascial system will affect your fertility. So when fascia gets stuck or twisted or dehydrated, our nerves and blood vessels get compressed and our organs can't move and slide. The organs can malfunction and they can't receive the proper communication from our nervous system, so they can't receive nutrients and oxygen from the circulatory system or remove toxins from our lymph system. So fascia maintains this biochemical integrity of all of our structures and reduces inflammation and irritation of all of our tissues, including those organs. So this concept of tensegrity, the first one is the model maximizes stability of our structure with the minimal materials, okay? The triangular shape consumes less energy because of the tension, making the body more efficient. The triangular shape also dissipates stress, force, weight, and movement throughout our structure. It allows the size of our structure to be theoretically unlimited. So we can keep growing this, and as long as we keep growing these triangle shapes, we can just keep getting bigger and bigger and bigger. It also provides a flexible structure and with continuous tension. So we can move and change and walk and ride a horse. It provides strength and resilience of the whole that exceeds the sum of its parts. And that basically means that the applied load is distributed throughout the structure. So if you lose part of the triangle, the load is going to be redistributed. So I wanted to talk about Tom Myers and anatomy trains for a second, because he really does an eloquent job of describing the fascial chains to kind of make this a little bit more understandable as far as how the whole body is connected and how it relates to movement. So in the picture, you can see there's 8 different chains of the legs and the trunk. Now, when addressing the physiology and pathophysiology, we must go deeper into the fascial chains and the fascial layers to make the connection with the organs more interconnected. Because they're not only connected with each other, but they're also connected to our bones and to every organ. So while it's really helpful to segregate the different fascial layers to understand movement, it's critical that we understand that with regards to pathology, it's one system, and any dysfunction in any of these fascial chains can result in a pathology that's anywhere in the body. So I'm going to get a little bit deeper, and I love all my pelvic floor slides, so excuse me if I get a little passionate here. But This is a great photo of the pelvic floor with regards to our organs. So you can see that there's a complexity and a connection between the ligaments of the reproductive organs, starting from the bladder to the uterus to the rectum. Now remember, ligaments are fascia, and the ligament that connects the pubic bone to the coccyx, we call this ligament the pubovesico-genital rectococcygeal ligament, aka the maxi pad ligament. I renamed it because it's a very long word. So the pubo is your pubic bone, so it connects the pubic bone first, then to the vesica, which is the urinary bladder, genito, which can be the uterus and the prostate, and the rectum is recto, and coccygeal is your coccyx bone, otherwise known as your tailbone. So the ligaments that support the reproductive organs here are directly attached to the fascia of the abdominal cavity, and we call that the peritoneum. And the peritoneum attaches the fascia to the abdominal muscles, which then connects to the fascial chains that we just looked at through Tom Meyer's anatomy chains. And each chain is connected to each other. So you can see how unhealthy tension or compression or constriction can affect one or more of these organs somewhere along this fascial chain. And this is going to happen at our weakest link. Now, we never know what that weakest link is going to be. It's different for every single person. So here you can see a picture to the right, all the ligaments that connect the pelvic bones and the hip socket together. So if you have a hip problem, you're likely going to have a pelvic floor problem and vice versa. Thus, a hip problem can negatively affect any organ in the pelvis. Now, looking at the picture to the left, we added back all the musculature that's connected to the pelvic bone and thigh bones. If there's any tension or spasm in the musculature, it's directly going to affect the pelvic and hip bones as well as the organs of the pelvis. So now we're starting to see how this is all interconnected. Okay. So now we're adding back the musculature, the blood vessels, the nerves, and the lymph, and we can really see how complex and interconnected the human body is. So the fascia of the musculature runs directly into the fascia of the pelvic floor and the peritoneal cavity, and that's the fascia again that lines the abdomen, and then all of our internal organs. The nervous system, the circulatory system, and the lymph system are all embedded in this fascial network that support our organs and our musculoskeletal system. So there's actually no specific distinction as the fascia runs from one area directly into the fascia of another area. It's kind of like when you're at a street and you're at this intersection and the street has one name on one side of the intersection and the street has a separate name on the other side of the intersection. It's the same exact street, we just call it something different. So all of our fascia changes names as it connects to a bone or it connects to an organ, or it runs up the body or down the body. It's going to change names, but again, it's the same organ. So I love these views of the pelvic floor. These are my favorite. So in both of these pictures, you can see the close proximity between the pubic bone, the bladder, the uterus, the rectum, and the sacrum, and the pelvic floor. So the picture on the right shows the fascial connections and all the intimate details of our pelvic organs, including those fallopian tubes. So you can see how the ligaments that are supporting the organs are embedded in the fascia. Now in the picture on the left, you're going to do a profile view and you can see where the sacrum is, where the rectum is, where the uterus is, and where the bladder is. And all those organs are basically touching each other and on top of each other. Now they've taken out the gastrointestinal tract, which is like we've got 6 feet of intestines that are mushed in there as well. So if any of those are irritated, you're going to have, again, at the weakest link is where you're going to suffer the most. Okay. So I want to talk about the boys and the girls because, boys suffer from, fertility issues as well. And I think we tend to leave them out too much. But adding back again, so we're going to add back everything. So we're adding back the connective tissue, the internal organs, the musculature, and you're going to see how interconnected and codependent every system is with each other. So being trained in allopathic medicine and being an allopathic provider for the last 18 years, I kind of have this like a contradictory feeling about medicine, and I feel sometimes like an oxymoron. But we were taught that all the organ systems function independently from each other. And it made sense at the time. And that's how we were taught. We were taught to cut through the fascia and open it up and look at these internal organs. But through studying connective tissue and studying our fascia and seeing all the connections, it makes complete sense that a misalignment in something is going to cause tension somewhere else, which is going to cause a pathology. And the pathology doesn't have to be in an internal organ. It can be in a joint space. It can even be in your brain. There's a whole fascial layer that covers the brain, and it goes all the way down to our tailbone and then all the way down to the tips of the toes. So we can potentially have your glute max muscle in your buttocks could be tight, and that can cause plantar fasciitis in the foot. you know, or you could have a shoulder issue where you've got a constriction or a rotator cuff tear, and that's pulling down and causing you to have a knee problem on the opposite side. Right. So what can we do to maximize our fertility? Okay, and that goes with preventative medicine. So, and this is, you know, osteopathy is preventative medicine. So when we talk about osteopathic medicine, we talk about nutrition, and we talk about water, and we talk about our posturing, we talk about our movement, how strong are we, how open and flexible can we be. We talk about proprioception, awareness of our joints. Do we know where we are in space? Because if we don't know where we are in space, then we can't actually correct our posture, and we can't address the way we move in space and how we drive and how we sit and how we stand. Global postural stretching is an exercise that we're going to talk about later. With regards to the circulatory and respiratory system, if we don't get blood and we don't breathe, we don't live. So we know if the heart stops or we stop breathing, we are no longer alive. And then we look at Aldoa postures. So Aldoa, again, we're going to talk about later, but it translates into longitudinal decoaptation, longitudinal osteoarticular decoaptation stretches. And then we'll talk about some osteopathic manual therapy. Okay, so food. Food is our body's fuel, and I have one rule for all my patients, and if it doesn't come from the earth, it should not be put in your mouth. So I understand that corn chips and potato chips, like half of that comes from the earth, but if you look at the ingredients, most of those ingredients don't come from the earth. So the first one I talk about is pasteurization. So pasteurization was meant for instruments. It was never meant for food. And that's why we have refrigerators, and that's why we have expiration dates. So what pasteurization does, it actually kills the good bacteria and the enzymes that we need to break down, digest, and absorb our nutrients. Now, the big thing nowadays is hormones. Hormones, pesticides, herbicides, they are all xenoestrogens. They all bind to our estrogen receptors. And they are called endocrine disruptors. So they're called xenoestrogens and endocrine disruptors. And there's a whole list of endocrine disruptors that you can get if you Google endocrine disruptors. Now, the government knows about it. They've had Senate committee meetings on it. For some reason, they're not removing them from the market. I have a whole other theory on that, though. So let's talk about antibiotics. So a lot of our meats and our foods have antibiotics in them, and this is going to disrupt our gut flora. It's also potentially causing us to have resistance to bacteria for when we get sick. Now, our gut is crucial, and it directly affects every organ system in our body, including our brain, our heart, our kidneys, our liver, and our reproductive organs. So our gut health is off. The rest of the body is going to be off. And that's basically because when the gut is off, it can become leaky. And then we start absorbing there's like a whole big thing on leaky gut now, which I don't have, I'm not an expert in at all, but I do believe in. And I think that we start absorbing things that our body shouldn't be absorbing because that barrier in the intestines has been ruined, and we're not able to protect ourselves. Okay. I'm going to talk about Teflon, and I think Teflon's now off the market. I'm not 100% sure, but rarely do we ever buy new pots and pans. But Teflon is that lining that covers our pans that makes it non-stick. And if we heat that Teflon up too high, it will absorb into our foods. It can also be aerosoled, and this is also an estrogen. It's also a xenoestrogen and will bind to our estrogen receptors. Now, on the DuPont website, and that is the maker of Teflon, you will read and find print that it has known to kill birds from inhalation, and it also can cause birth defects if it's been ingested. Crazy. Okay, common food allergens. All right, so common food allergens will elicit an immune response that may affect your fertility. And those common food allergens are going to be wheat, gluten, dairy, corn, soy protein, sugar, and high fructose corn syrup. Now, gluten, back before the, I think it was like World War II, our breads were allowed to ferment before they were baked and sold. And with the war, they needed to make foods very fast, and they stopped allowing our breads to ferment. So we have a higher than normal level of gluten and probably yeast in our breads than we did back then. So now everybody's coming up with like these gluten and wheat allergies or hypersensitivities. That's because there's just so much in it because we're not allowing our food to be prepared properly. Most of corn is genetically modified. A lot of dairy is exposed to antibiotics and hormones. And then we look at soy and soy protein. Tempeh and soybeans are so good for you, but it's when you get into that processed form of soy, which is like your tofu and your soy milk, it's going to be more detrimental and provide too much estrogen for the body. And then we all know that sugar creates an inflammatory response. Now, high fructose corn syrup, I don't have time to lecture on it today, but just know that it was banned in most countries, including Canada and China and the European Union, which means all of Europe, as well as Australia and New Zealand. And those are the countries that I've looked at. Now, cooking oils that are safe to heat, that's gonna be your coconut oil and your grapeseed oil. Olive oil is so good for you. You know, pour it down your mouth, put it on your tomatoes, whatever you want to do with it, that's great. Just don't heat it, because once it's heated above, I believe, 350 degrees, it becomes carcinogenic. All right, animal fat. It's healthy in moderation. Don't shy away from it. Your body may need it. And you cannot eat too many vegetables ever. And then again, fruit is a sugar, so eat it in moderation. Okay, importance of water. So water is the most important and abundant inorganic compound in all of our living systems. Nearly all of our body's chemical reactions occur in a watery medium, and many of its properties make it indispensable for all compounds of life. So what does water do? It helps regulate our body temperature, it removes waste, cushions our joints, helps carry nutrients and oxygen through the cells, it moistens oxygen for breathing, it helps convert food into energy, it protects and moistens our vital organs, and helps the body to absorb nutrients. So the human body is 70% water. Fascia is 60 to 75% water. Muscles are 75%. I could go on and on. So the take-home message here is drink more water. So Guy Voyer, his little quote that I have here is, the worst two enemies of fascia are dehydration and stress, and he couldn't be more right. Ooh. Okay. Sorry about that, guys. I have a little thing on the left that's supposed to show you the collagen tubules. And for some reason, I don't know how to make that work now. But I was actually so proud of myself for being able to show you how collagen tubules move. Anyway, all right, so how to intake water. First thing you want to do is make sure that you drink a lot of water, and that's going to be half your body weight in ounces. So, and I have half to 3/4 of your body weight, because if you sweat, if you drink alcohol, if you drink coffee, things are going to be dehydrated, and you drink a lot of sugar, you're going to need to increase your water intake. So the best way to, and that we have been, told or taught, and Dr. Voyer does have a degree in hydrology, is to drink a lot of water in one sitting. So you drink a half to 1 liter of water, when you wake up in the morning, and then another half to a liter at lunchtime, another half to a liter at dinner, and then you don't drink any water in between. We want the body to actually absorb the water. So if we put it in a state of like, lack, where it's lacking, where it's worried it's not going to get some, it's going to absorb everything you give it. Now, I don't say that with food, but with water, that can help to hydrate the body. Now, you want to start slowly, because hydration can take a few weeks. So if you start drinking a lot of water, you probably will urinate a lot. So give yourself 3 to 5 weeks to start absorbing water. And there is a possibility that you may not become hydrated. That you're doing all these things. So you want to check and see how often are you urinating. And then there are some dysfunctions that can prevent hydration. And one of those is your cortisol levels. And that's, so you might need to check out your adrenal glands. Are they exhausted? Are they working too hard? And then your kidneys. So aldosterone is a hormone that helps you reabsorb water, and there could be something wrong with your renin-angiotensin-aldosterone system that's preventing the reabsorption of water. And that would be something that you would need to be tested for, and you can do a 24-hour urine test. You just need to have a doctor to order that for you. Now, on the right, where I can't get my little collagen tubules to expand, fascia's one job is to store water, and that's through the collagen tubules. So as the collagen tubules lengthen out away from each other, water osmotically shifts into the tubules, hydrating the cells. So collagen not only moves water into the tubules, but you also have to have water to move it. So if you're really dehydrated, those collagen tubules aren't going to be able to fill up with water, and the fascia is going to stay stuck. And when fascia stays stuck, that's when we get sick. Okay, posture. Okay. So nobody really wants to talk about posture. So I'm going to. So if our spinal column is compressing the nerves that innervate our organs, leaving the spine, the organs cannot function properly. And this is how we get a disease or a disease of our organs. So good posture involves training the body to sit, to stand, to walk, to lie in positions where there's the least amount of strain is placed on the supporting muscles and ligaments during movement or any kind of weight-bearing exercises. Now, when I was recovering from my traumatic neck injury, part of my osteopathy program was, again, learning how to sit, how to stand, how to drive, how to walk, how to brush my teeth, and all these things I had to relearn. And it's not easy and it's not fun, but in order to put the body back into a state of health and to allow these nerves to leave properly, we have to do the work. Now, there's 4 curvatures in the spine that are really important, and a lot of us have lost them. And that is the cervical curve, that's your neck. Thoracic is going to be your mid-back. Lumbar is your low back, and sacrum is your pelvis. And the curves are there for an actual reason. They're there to absorb and dissipate stress from movement of the body and any kind of force that's from weight or gravity. So if you're picking up something heavy or you're jumping off of a stool, the spine is there to absorb and dissipate the stress, kind of like that, part of that tensegrity model. And then, the spine is a tensegrity tower, and it integrates the limbs, the head, the tailbone, and the visceral system. So again, it's all connected. So posture. Which one of these are you? So I want you just to take a moment to maybe look in the mirror or pause this video and just take a look in the mirror, or have someone take a profile picture of you at some other time when you're standing and you're just in a normal state, you're not trying to be good, so you can see which posture you're at. And none of us really have a balanced posture, and mostly that's because of the shoes that we wear. A lot of our shoes have elevated heels and they push our weight forward. And the body wants to be straight, the head wants to be even, and the brain is going to compensate in order to make that happen. So if we start ignoring the body's need for this healthy alignment, it's going to cause atrophy of the muscles and asymmetry between our right and left sides of the body. So our internal organs are not symmetrical, but the bones are, or they should be. There are some exceptions. But each side is loaded by gravity and weight, and it should act like equal opposites. So they work in conjunction with each other. So when we stand and move unhealthily, these load-bearing joints can't work together, and the compensatory muscles needed to activate to support our skeletal structure throw our joints off balance. And throwing our joints off balance prevents proper positioning, forcing our bodies to move in a way which we were not designed to do. So our musculoskeletal integrity is compromised. And again, fascia connects our musculoskeletal system with the organs of our body. So are we going to have an opportunity to cause some kind of compression or tension in the fascial system that's going to affect our internal organs? So again, I don't have time to go through each of these. So I'm going to just summarize like the anterior tilt and the posterior tuck of the pelvis. So if your pelvis is tucked under, you're causing a posterior tilt, and water is going to spill out the back of the bowl. Now the pelvic floor muscles are going to have to tense, and the lumbar spine is going to flatten. And this is going to cause a hyperkyphosis, so an over-rounding of that thoracic spine. And that's going to compress the chest and the abdomen, pushing all your abdominal and pelvic organs into the pelvic floor. So it's also going to cause a forward head posturing. Now, if your pelvis is anteriorly tilted, meaning it's spilling water out of the front of the bowl, this will cause a hyperlordosis, so an extreme curvature of the lumbar spine, so it's an overarching. And this is going to relax the pelvic floor and the abdominal wall so that they can support the abdominal organs that are being pushed into the pelvic floor. And this is going to cause, again, a hyperkyphosis, so that over-rounding of the thoracic spine, causing that forward head posturing. And so the body wants to stay upright. The brain wants to keep your head on straight, so it's going to compensate where it needs to allow for this to happen. All right, so at the end, I'm going to give you a bonus on how to create a healthy gravity line. So we're not going to go through it now, but please stay tuned for the end. So we're going to talk about movement and exercise, and if we don't use it, we lose it. So if we look back on history and Darwin's theory of evolution, our bodies adapt to survive. So our muscular strength, our flexibility, our mobility, our proprioception, they all accommodate to perform the changing responsibilities that are thrown at us during evolution. Now, if we think of adaptability to our environment as a positive effect on civilization, it is positive. However, there can be detrimental consequences, and that's what's happening right now. So while we all have intellectually adapted to the electronic revolution, and even little like 2-year-olds can use an iPhone, our bodies are not adapting so healthfully. So with regards to the musculoskeletal system, we're getting sick because our internal organs are being compromised to the point of disease and dysfunction. So coming back to this point, if you don't use it, we lose it. It's a very simple concept. If you slouch at your desk all day, the muscles that support your spine and your pelvic floor atrophy because of the domino effect on the musculoskeletal and the organ system result in disease and dysfunction. So most of us do nothing to reverse the damage that we've done during the day, and we've completely underestimated the importance of strength training and myofascial stretching. So when our musculoskeletal system is weak or flaccid, I hate the word flaccid, but it's very true. No woman or man ever wants to be called flaccid. But we cannot support our skeleton or our internal organs. So we can segmentally strengthen individual muscles to balance out these muscular discrepancies, and we can strengthen specific muscles that have atrophied to support our structure and internal organs. And if all of our muscles are tight and rigid in our skeleton, then the organ systems can't move freely either. So it's a fine-tuned balance between strengthening and flexibility. So there's myofascial exercises that are specific to the muscles that can open up compression and the muscles of the fascia. Then stretching is essential to release tension and compression, but first we have to have a muscle to stretch. So if a muscle is atrophied or flaccid, there's no muscle to stretch. And it's like pulling on a really weak, tattered rope. You keep pulling on that tattered rope and eventually it's gonna break. So many people and this is a great example, so many people focus on stretching their hip flexor, that psoas muscle. But it's because they sit at a desk all day or driving all day, and this muscle actually doesn't get worked. It gets compressed and it gets tight. So then we go to a yoga class or we go to the gym and we try to stretch out that psoas muscle, but you're stretching a muscle that doesn't exist. There's no strength there. So we need to strengthen the muscle before it can be truly stretched. And there's ways to myofascially release this muscle without putting unhealthy tension on it. So we actually get to the belly of the muscle and we don't stretch the ligaments or the tendons that surround it. All right, the circulatory system. So the first rule of osteopathy is that the rule of the artery is prime from A.T. Stills. So meaning that if you get blood to a diseased or injured area, the body's going to heal itself. So as you all know, the arterial system, which is pictured in red, not only delivers oxygenated blood and nutrients to every cell, but it also delivers drugs and medications and toxins. So it's not just the arteries that are important. We need to talk about the venous system. And the venous system's in blue. And that removes deoxygenated blood and waste along with the lymph system and from every cell of our body. So the venous system was brilliantly designed to wind in and out and around our musculature so that our muscles can contract and move blood back to the heart. Because our veins don't contract. They do have valves that prevent blood from flowing backwards. But when we were hunters and gatherers, the system worked great. We were moving all the time. But our activities of daily living now don't move our venous circulation. You know, we created automobiles and desk jobs, and now all we do is sit all day, and there's nothing there to help the blood go back to the heart. So with that being said, we tend to focus the importance on blood leaving the heart, and we forget about the returning to the heart. And these two systems have to go hand in hand. Deoxygenated blood doesn't return back to the heart by the venous system, then the oxygenated blood can't be pumped back to the body. You know, we've got this closed system of fluid, so it's got to keep circulating. So when the blood can't get back to the heart, it becomes stagnant and it pools. And the most obvious signs are seen with varicose veins, and those occurs usually in our legs, but you actually can get them in your labias, especially when you're pregnant. So the venous system becomes stagnant because of our sedentary lifestyles or weak musculature. If we move too much, so if we overuse or overtrain, emotional stress can lead to tight muscles, trauma, leaky valves, and weak veins, usually seen with like peripheral vascular disease and varicose veins, too little nutrients, too much sugar, too much alcohol, and then any kind of damage that can impair function. So we have exercises for the circulatory system to get blood to go back to the heart to support specific areas. So we can do just the ankle or the foot or the knee or the pelvis. And here we're going to talk more about the pelvic ones. But the best way to get blood back to this heart is to physically move the blood using our musculature. And there's exercises, like I said, designed to do this. So this one focuses on the external rotator. So our external rotator is kind of like of our butt muscles. And what we do is we do a dynamic movement that pumps the blood much like you would squeeze a squishy ball while you're giving blood. So we contract and we release and we contract and we can release. And we do about 10 to 20 repetitions. And then we do a static movement, which is a hold of a contraction. And then the last part is the osteoarticular relaxation with the help of gravity to move the blood back up to the heart. Now, if there's no circulatory problem below this point of the pelvis, you can start moving from the external rotators and then go to the hip and the internal rotators and your butt muscles and your psoas muscle and the lower abdominal muscles to move the blood back. But you need to be evaluated to see, is there some kind of pathology that can happen lower in the body? All right. So the diaphragm. Okay. So in order to understand why the diaphragm is important, we kind of have to understand the anatomy of it. So the diaphragm is the main muscle of respiration, and it's the most physiologically important muscle in the body. And like every other muscle, if we don't use it, we're gonna lose it. So the lack of strength and tone of the diaphragm is pretty much an epidemic in the 21st century because of all the sedentary lifestyle that we have. We rarely partake in activities that exercise our diaphragm, unless you're like, singing in the car every day, which I recommend you do. There are specific exercises that can strengthen and stretch the diaphragm. But when the diaphragm is fit and is functioning, it contracts to pull what we call the central tendon. So the central tendon in that first photo is that white area that connects the dome of the diaphragm together. That central tendon is going to move down towards the abdominal cavity, and it brings with it the heart. So when that dome is allowed to, when the two domes allow the lungs to expand, it moves the abdominal organs up to 3 to 5 inches with adequate breathing, while the fascial attachment at the heart moves the heart about 1 to 1.5 inches. So just like your muscles like to be massaged, so do your internal organs, because when we move those internal organs, we water the fascia and we allow the organs to move freely. So a strong and properly functioning diaphragm allows for even distribution for the breath in both the right and left lobes, which is going to help you balance both the front and the back of the body. Now the diaphragm works interdependently with the pelvic diaphragm, which is made up of our pelvic floor muscles. So if the thoracic diaphragm is restricted and is unable to move up and down, that pelvic floor is going to get restricted also. So the abdominal organs are supposed to rise and fall with the breath. And if they're not rising and falling, then they're just falling into the pelvic floor, causing an imbalance of those pelvic floor muscles, and they negatively affect our organs. So when our organs don't move, again, our fascia that contains them, and all the connections become very restricted. Now, breath. So when we breathe, it's innate. It's controlled by our brainstem. We don't even have to think about it. It's just an action that we do. But it gives us life. So if it's not only vital to our survival, but it also helps to relax the nervous system, and we know that through yoga. It's also scientifically been proven to affect the heart, the brain, our digestion, and the immune system. So it's one of our bodily functions that we could not live without. But we never observe how we breathe. We never think about how we breathe. So just take a moment, and you can pause the video if you want, but take a moment to just see how you breathe. Like, do you hold your breath in when you're nervous or scared? Do you hold your breath out when you're nervous or scared? Do you breathe just into the upper lungs? Do you breathe into the lower lungs? Do you breathe into your belly? Are you just a belly breather? Are you just a chest breather? So taking a moment to really get to know where your breath is will allow you to hopefully change how you breathe to allow the diaphragm to start functioning more properly. And at the end of this presentation, I'm going to give you an exercise to do that will help you get some proprioception awareness back to that diaphragm. All right. So now we're going to talk about proprioception awareness of the pelvic floor, and I want to talk about the jade egg. So now the pelvic floor and proprioception of it is really important to understand all of its ins and outs, and that's because the pelvic floor not only allows things to enter our bodies, but it also allows things to release out. So we have to have a balance between contraction and release. Now, I'm not going to rave over the benefits of the jade egg. That's not what I'm here to do in regards to this following list, and you're welcome to read the list of the benefits of the proprioception awareness as far as the jade egg is concerned. And I do want to address the fact that I have read some articles online where physicians do not recommend you using the jade egg because it's dirty and increases your risk of infection. So I'm here to tell you that if you clean your jade egg properly, it is not dirty nor is it harmful, and there are plenty of other dirty and harmful things that we put in our vaginas, including a penis or sex toys that may not be as clean as a jade egg. So one thing is you do not want to use a jade egg during your menstrual cycle or while you're on your period or during pregnancy, or if your body's not open to receiving it on certain days. Now I'm going to give you a meditation to do with the jade egg. Now you do not need to use a jade egg to do this, so you can do the meditation without it if you don't feel comfortable using it or it's just something you're not interested in. So the reason why I want to address it is because the jade egg practice can allow you to isolate the different parts of your anatomy and give you a greater pelvic floor awareness and greater understanding of the whole entire pelvic floor. So the pelvic floor awareness, it's important to have a bowel movement, it's important to orgasm, it's important to birth a baby. And the pelvic floor is not only connected to every organ, but it's also connected to our heart. And if we've had any kind of trauma, emotional or physical, this is going to affect our organs of reproduction. And I'm not saying you can't get pregnant. I'm just saying it's going to affect the organs of reproduction. And that's because our nervous system is embedded in the fascia and it responds appropriately to protect us even when the trauma is gone. Let's talk about orgasm. This is fun. This is a fun topic. Okay. So orgasm, there is a physiological function to orgasm. Orgasm is good. So it's a natural physiological process that happens when we have sex with or without someone else. I'm going to discuss orgasm as part of the osteopathic approach because there is a physiological and muscular response. And the uterus is a muscle and the uterus is lined by fascia. So we all know that an orgasm is not necessary to conceive and that not all women orgasm from sex, and some women have never orgasmed, and all of this is okay. What I'm just suggesting here is that orgasm and the release of oxytocin can aid in conceiving. So we know through radiographic imaging that when the uterus contracts from an orgasm, the cervix will swoop up sperm into the uterus. Now, if you have the correct cervical mucus, and that's going to be that raw egg white mucus, the sperm can survive. And then if further the contraction of the uterus, it actually contracts in a way that sperm is pushed towards the fallopian tube and the ovary from which you're ovulating.
I don't want to interrupt you, but I do have a question.
Yeah.
So, but what about women who don't orgasm or they feel like they can't orgasm?
That's a really good question. So majority of women, I would say the majority, I don't know the statistics, but I think it's somewhere around 50% of women can't orgasm from sex, or majority of women don't orgasm from sex, or they can't orgasm at all. And again, like I said, you do not have to have an orgasm in order to get pregnant. And a really interesting study came out of the Kinsey Institute from Bloomington, Indiana. And they said that, and I love this because it really gives us a reason. It's like not my fault. I'm not doing anything wrong. There's nothing wrong with my body. But the location of a woman's clitoris is directly linked to the ability to orgasm through vaginal intercourse. And most women's clitorises are located just a little bit too high for it to be maintained. For stimulation to be maintained during vaginal sex. So ladies, don't worry. If you're not having any orgasms from vaginal sex, you do not have to have vaginal sex to achieve an orgasm. And if it is, a point where you are trying to get pregnant and you want to have an orgasm, let the sperm enter the vagina first, whether through sex or, a turkey baster, however you're doing it, and then have an orgasm after. And that way the cervix can swoop it up. So I recommend all of my patients who are going through timed intercourse and IUI cycles, IUI being intrauterine insemination, to have an orgasm after the insemination. And when they are doing timed intercourse, I recommend that they have their husbands ejaculate first, and then let them have an orgasm. Now, a lot of times women are not going to have an orgasm after a man ejaculates, right? Because that may not stay erect for too long, which means that you're going to need to have an orgasm another way. And that's any way you want, with him, without him, it doesn't matter. Orgasms are fun, whether we have a partner or don't have a partner. Okay, so I want to talk about oxytocin because the orgasm causes a release of oxytocin, and there are oxytocin receptors found in the endometrium. So that's the lining of our uterus. Now, there have been some studies, and studies are suggesting that there is a biological function of oxytocin during the menstrual cycle. Baker al, he found that patients who are subfertile have less endometrial oxytocin binding sites than fertile women. And he also found that treatment with Clomid, and that's kind of the first line treatment that we use for women coming in with fertility, if they qualify for insemination cycles or timed intercourse. So that's someone who's not ovulating, maybe someone with polycystic ovarian syndrome, or some kind of anovulatory dysfunction, or they're older and we need more than one egg, we'll use Clomid to let that happen. And it does show that when we use Clomid, it increases the concentrations of oxytocin back to normal levels. And then there was another study that speculates that oxytocin, there's an oxytocin-mediated link between ovulation and sexual activity. So pre-ovulatory women were given oxytocin right before their LH surge, and it actually had advanced their LH surge. Now, we also know that estrogen levels cause an LH surge. So we really don't know what all this information is suggesting, but it's worth further investigation to find out. All right, now we're going to go back to our exercises. So global postural stretching, also known as GPS, is part of the BioTensegrity model, and it's a model that we state that explains that tension anywhere in the system will instantly signal the rest of the body, creating a response somewhere else. So with with the tensegrity model, basically what it's alluding to is that any load on the human body, including gravity, distributes throughout the whole system from tension to compression. And any tension or compression will have a domino effect on the human body, and it's going to go where, like, what's going to suffer is your weakest link. And again, that can be anything. That can be a muscle, a bone, a joint, or an organ. So I want to go through the different positionings of the uterus because we actually have a GPS stretch that will allow us to move the uterus. So there's different variations. So we can have an anteverted uterus, an anteflexed uterus, midline, retroverted, and retroflexed. And then the uterus can also deviate to the right and left. Now, I want to make very clear that you can have any one of these uteruses. It can deviate to the right or left. It can be retroverted, retroflexed, or anteverted, and you can still get pregnant. So just because you have a retroverted uterus doesn't mean that you cannot conceive. As long as it doesn't affect the structures of how you would ovulate, how the tube would pick up the egg, how it would travel down the tube, and how it would implant into the uterus. So I don't want you to, start panicking that, oh my God, I have a retroverted uterus and I can't get pregnant.
But what causes the uterus to be in different positions?
So it's a really good question. So some of them is just natural, it's just normal positioning of the uterus. Majority of uteruses will be more anteverted and anteflexed or midline. So those retroverted uteruses and the retroflexed uteruses, surgery, anytime that you can have some scar tissue, if you open up the abdominal cavity, scar tissue is that's reticulum, right? Mm-hmm. So it's gonna stick. So that can cause any kind of trauma. If you have any kind of tension in the fascial system that's pulling the uterus back, a C-section, again, as part of surgery, a previous pregnancy that maybe changed the function, or the structural structure of the pelvis. Endometriosis can cause some scarring and the uterus can get stuck on that. Uterine fibroids will likely displace the uterus. And any pathology of the gastrointestinal tract or weakness and the tension in the pelvic diaphragm and the thoracic diaphragm can also cause a change in the uterus. And these are just some of them, they're not all of them, but okay. So let's talk about, does that answer your question?
Yes, thank you.
You're welcome. All right, so global postural stretching. I love how intense my face is here. So this is for when the uterus can deviate to the right or the left. And my uterus is actually deviated to the left. And I have not started my global postural stretching exercises yet because I have so many other Aldoa postures that I do. I don't have time yet. But I do know that when I ovulate on my left side, I have excruciating pain. And when I ovulate on my left, I have zero pain. So I know exactly when I'm ovulating, I know exactly which ovary I'm ovulating from. And that's just because on the left side, I'm deviated in that direction. There's just not as much room. So if there's fluid that comes out during ovulation, that's going to irritate the nerves and the organs around it. So the GPS exercise it's a global tension on the fascial line that directly links it to the uterus. It's an active posture that requires a global muscular contraction. So I am not just laying on the table here, just chilling out. I'm probably sweating, to be honest. And performing it once is not going to move your uterus. So me doing this taking the picture for this did not move my uterus at all. I wish it did, but I need to practice this every day. So the deviation of the uterus can, like I said, displace the uterus from the fallopian tubes. It could possibly affect the fallopian tubes from collecting the ovulated egg, and it could potentially cause pain or discomfort during your menstrual cycle and or during ovulation, or affect your bowel and your bladder functions. Okay. All right, so Aldoa. Okay, so this is kind of the bread and butter of Guy's work and the work that I do, and it's called Intéressement longitudinal avec décoaptation osteoarticulaire, and you'll have to excuse my poor French accent, but in English it translates into longitudinal osteoarticular décoaptation stretches, and it was developed by world-renowned French osteopath Dr. Guy Boyer. And I want to go over his history real quick just because it's really important to understand why the Aldoa is so important. So he started off as a judo champion, and after the world champions, he became a personal trainer. His idea was that France was inflicted with back pain, as was the whole entire world, but he was French. So he wanted to cure back pain, and back pain was a huge financial strain on the French economy. So from becoming a personal trainer, he went to become a physical therapist, and he quickly realized that in physical therapy that he was prescribing these exercises that were not effective, and patients were still taking over-the-counter medications that were causing side effects. So he's like, that's cool, I'm gonna go to med school. Who says that, right? I'm gonna go to med school, and not only gonna go to med school, but I'm gonna get board certified in 10 different things. So he is, and I don't remember all of his board certifications, but 2 of them that are most important is sports medicine and orthopedics. And again, he was, trying to heal back pain, and all he was doing was either doing surgery or he was sending them to physical therapy and prescribing these meds. And he's like, well, this doesn't work. So he decided to go to osteopathy school. And in Europe, osteopathic medicine is slightly different in the States. So it's just manual therapy, whereas in the US, you actually practice as a medical doctor. And he went to 4 different osteopathy schools to study every aspect of osteopathy. So he came up while he was in school, he developed these, he also had access to bodies. And his uncle owned a mortuary, so his uncle let him kind of dissect bodies and study fascia. So to say that he was a geek is beyond, but I'm a geek too because I love his work. So he came up with these postures that put tension on the fascial lines, and in order to confirm his postures, he actually put his interns into X-ray machines. So and then he had a big clinic down in Marseille, and he would give these postures to his clients, and they would come back 6 months later and they would be like, well, my back pain's a little bit better, or my back pain's totally better, or it's not better at all, but hey, I'm sleeping better, I'm not snoring, I don't have acid reflux anymore, well, my periods have gotten really much lighter, I'm not cramping as much. And he thought, oh my God, how stupid am I? And he actually uses that stupid word, he just does it in a very thick accent. He said, I completely forgot about the fascial connections on the spine and the nerves that innervate, which is how this whole paradigm came to be, which is why I want to talk to you about it. So what are Aldoas? Aldoas are precise self-normalizing exercises that create healthy tension on the fascial line to decompress articulations in the body. And articulations are our joint spaces. So most Aldoas focus on the spine. They strengthen the muscles along the back body. They stretch tight or restricted fascia, and they create a normalizing effect around all of our surrounding tissues. So the benefits of Aldoa, they're so numerous. It decreases pressure between the vertebrae, it reduces disc herniation, it delays degenerative disc disease. It can help with scoliosis as far as preventing worsening of curvatures or actually reducing curvatures of the spine. And how does this relate to fertility? Because all of these are fascial connections and nerves. Now, Dr. Boyer had a patient who had scoliosis or has scoliosis. And she had 2 60-degree curvatures, so she had an S curve, and her medical doctors told her that she would never be able to conceive unless she had her spine fused, and that's a major, major surgery. So she was a dancer by trade, found Dr. Boyer, and she said, can you please help me? And he did some manual therapy on her, some osteopathic manual therapy to help realign her body. And then he gave her these Aldoa postures, and her curves reduced down from 60 and 60 degrees to 30 and 30 degrees. And she now has 3 beautiful children. So every morning she wakes up and she spends 20 minutes doing her Aldoa postures before she starts her day. Her husband's aware, her kids are aware, they are not to bother her while she does her Aldoas. All right. So Aldoas for the reproductive organs. And I'm not showing this picture so you go home and do these. These are very specific exercises that are for your body that require a lot of micromanaging. And the first posture that you're going to see on the left is L2, L3. So L2, L3, and L3, L4, those are where the nerves leave the spine and innervate our internal or our reproductive organs. Now, depending on your specific needs, you're going to need more Aldoas. So L2, L3, and L3, L4 are part of my practice because I have scoliosis, but I also have to do thoracic Aldoas and cervical Aldoas to maintain the rest of my body, again, because it's all connected. So if I just do my lumbars, they may or may not help me get pregnant, but if I fix the whole entire chain, that'll help me be in perfect alignment. So that last posture that you see all the way to the right, that's that's L5S1, and that is a posture that we do before we start our Aldoa practice and a posture that we end with the Aldoa practice. Okay. So osteopathic manual therapy. So the goal of OMT. We've been talking about this a lot, but if we fix the structure, then we can fix the function of our bodies. So so osteopathic medicine was very big on structure dictates the function of our body, or actually Dr. Guy Boyer is very big on structure dictates function. So if we can normalize the fluid in the fascial system, because remember collagen absorbs water, we call this the primary respiratory movement. So if we can normalize this, then we can normalize the bones, the fascia, the soft tissue, and the internal organs. Now the primary respiratory movement, like I said, is your body breathes. So just like your lungs breathe oxygen, our cells breathe water. And you can actually feel the primary respiratory movement if you put your hands on somebody and you get quiet enough, you can feel the body breathe. So osteopathy, that manual therapy, helps to normalize that fluid tension. So if the fascia is restricted, we can release the fascia to allow the fluids to go in. Now, it's also there to normalize the tensegrity of the biomechanics, right? So we can attain maximum health. And again, this is going to normalize the bones, the fascia, the soft tissue, and the internal organs. Now, I want to just explain the difference between chiropractic manual therapy and osteopathic manual therapy. And chiropractic manual therapy came out of osteopathy, and that deals with just the bones. So we crack bones. Now, there are a lot of chiropractors nowadays who are studying the fascial system, and they are amazing. And I'm so glad, because if we just crack a bone and we don't do anything to support the ligaments and the tendons and the muscles and the soft tissue around that adjustment, we tend not to hold that adjustment, or we can cause more damage than good. Okay, so we're putting it all together now, and structure dictates function. All right, so with that being said, with the discovery of fascia, we cannot deny that the body is all connected. And if one organ is off of the system, any of the other organs can be off. Or if any of the joints are misaligned, the whole system can go down. And we are always going to suffer at our weakest link. My weakest link is my neck. Someone else's weakest link could be their intestines. Someone else's could be their uterus. And there's a domino effect from that weakest link that's ultimately going to affect our internal organs. And we may not know these until we try to conceive, or we try to do something that we cannot do. So we have the ability to fix the structure, which will in turn correct the organs and the fascial lines and the fascial chains. But it does take a lot of work. Like, as we've talked about, there's strength training, there's stretching, there's circulatory and respiratory system, there's global postural stretching postures if your uterus is deviating, and then there's the Adele postures. This is not an easy thing to do, but it's necessary if we're going to put ourselves back into normal, healthy alignment, so we can just live normal, healthy lives. Forgetting pregnancy and fertility for a second, but just so we can, wake up in the morning without pain. We can sit at our desk without pain. We can, get rid of our forward head posturing, so our body can communicate as one and function optimally. So thank you so much.
Oh my gosh, thank you. Let me just get us back up here. And we'll do this. Wow, girl.
A lot of information. I'm sorry.
Not sorry. I mean, there's so much, but it's such good information. And I'm blown away, as I knew I would be.
Thank you. It's a lot of information. It's overwhelming to study it and to learn it. And once you do, you just have to tell the world, stand up straight.
Exactly. So for our listeners, stay tuned. All of her free gifts and bonuses will be available to you. And I think you also had mentioned that you wanted, as part of that, to give a free 30-minute consultation.
Yeah, I would love to. I'd love to talk to some of you out there and find out what your body needs, or where your dysfunctions are, what your concerns are, so that we can point you, or I can point you in the right direction to someone who can help you, either in another state or in this state, or wherever. So.
And now with technology and stuff, I mean, you can definitely connect with Wendy in a lot of different ways. Her Facebook handle is at Eldoa Los Angeles. Her IG handle is at wendy.shubin.eldoa.la. And her website, which I'm sure you can find all of her handles and all of that, is wendyshubin.com. And for those of you who are in the Los Angeles area, I highly recommend that you reach out to her and go see her. You will not be sorry. And I just want to thank you again.
Thank you so much.
And of course, and thank you to our listeners for being here, and stay tuned for the next one. And we'll see you on the next round. As we like to say, closing our yoga practices for our fertility yoga, Namaste.
Namaste.
We'll see you next time.